Premier Doug Ford will make an announcement at 11 a.m. Eastern today alongside Health Minister Christine Elliott and Dr. Kieran Moore. Now, among the measures being considered, no indoor dining, limits on banquet halls and weddings, gathering limits of 25 people outdoors and 5 fully vaccinated individuals indoors, a 50% capacity limit on essential retail and 25% capacity limit on non-essential retail. The province is also considering cancelling all ticketed events as well as reimposing limits on gyms, as well as personal care services. Let's bring in Dr. Bogoch now, infectious disease specialist at the University Health Network. Good to see you, Dr. Bogoch.
Hey, good morning, Angie.
Good morning to you. So in a couple hours' time now, we're going to be hearing from the Premier today. Surging number of cases in the province. What are you anticipating we're going to hear from the Premier? What are you hoping to hear from him today?
I think we're going to hear exactly what you just parlayed. I suspect that that's the case, right? You've got very, very high case numbers. It is translating into a growing number of hospitalizations and a growing number of ICU admissions. That's clear. We know that those are a lagging indicator. They've lagged, and now they're starting to go up. And I think in addition to that, you'll probably hear discussion about absenteeism, especially from vital sectors of the province. You know, this is not just a healthcare related issue. You've got to keep the lights on. You've got to keep the supply chain going. And you know, when you have such a burden of COVID-19 in the province, you've got to ensure that vital sectors can still function. So I wouldn't be surprised if we hear about measures to really curb areas where COVID-19 can be amplified. And, you know, let's see what happens at 11 o'clock.
Yeah, exactly. When you talk about shortages, we are hearing from nurses as well that many are calling in sick because they have gotten sick now and can't come into work. And there's that concern and that confusion there. I also want to ask you about schools. And a lot of parents, of course, are waiting to hear what the Premier is going to say about schools. We know that there's been a lot of debate. That reopening had been pushed back by 2 days, so it's supposed to happen Wednesday. But there are, you know, the unconfirmed reports that it could possibly, they could be going online for 2 weeks or so. What are your thoughts there in terms of what the situation is in schools?
I'm also one of those parents waiting to hear about what's going to happen with schools, so I'll be watching that very closely. I'm a big fan of kids going back to school. I think it's extremely important for kids to go back for obviously education and social development. I also think closing schools is truly one of the biggest inequities from a policy standpoint that we can make, because it has such a negative impact on every working parent, especially mothers. So we have to be very, very careful about school closures. But of course, in the same breath, you've got to create a safer school. You've got to have a safe school environment. If you're going to close schools down, you've got to use that time wisely to create a much safer indoor space that improves the ventilation, which we've heard about in Ontario settings, that has good quality masks, that it prioritizes vaccination for everyone who's going to be under that roof, including the educators and the administrators, but of course also the students as well. So if there are going to be school closures, let's hear what's going to be happening with that time that will be bought in the week or 2 weeks that these students will be being taught, will be online.
When those schools open, hopefully it is within that couple of days period or whatnot, we understand that they won't be reporting cases in schools. That won't be sort of part of the reporting. You know, the respective school boards are saying they've sent a letter home to parents saying we'll try and keep you informed of cases. But what are your thoughts there? Parents are going to want to know if there's a case, you know, in their child's classroom or in their school and want to take the appropriate action.
Absolutely. I mean, as mentioned, I think we've chatted about this before. It's an important topic. And you know, I'm a fan of transparency, and I think many people are. That builds trust, and that might help guide some parents' decisions to either send their kid to school or perhaps choose an online option. So I think even if the data is not perfect, even if there's limited data and limited tests. I think more information is always better, and that information, however imperfect it is, should be shared with parents. It might help guide decision making.
Yeah, certainly. Well, let's hope that's something that does get reinstated. Before I let you go, Dr. Bogoch, we know that the CDC earlier on made their recommendation from the reduction of the isolation period for those who are fully vaccinated from 10 days down to 5 days. They are saying that they're now considering a negative test along with that 5-day isolation period for those who are asymptomatic. What are your thoughts there? Canada kind of followed the lead on the CDC, or I should say the respective provinces did so, though Health Canada is still maintaining that 10-day isolation period. But what about the negative test in addition to that?
Yeah, I mean, this is important, right? Like, it's fair to acknowledge that most people are going to be transmissible a couple of days before they develop symptoms, however mild those symptoms are, and for a couple of days after those symptoms. But some people, even if it's a small percentage, some will still be transmissible at day 5. If the whole goal is to get people back to the workforce and to maintain your personnel at work, you do not want to be introducing COVID-19 and having people re-enter the workforce who are still transmissible. You can do one of two things. You can either extend that isolation period to something like 7 days instead of 5 days, where even a smaller percentage of people will re-enter the workforce who are transmissible, or you can add an additional test, which is like a negative rapid test if you have access to them. And that, again, it's not perfect, but it adds a greater degree of safety and certainty that people aren't entering the workforce that are able to transmit COVID-19. I think that's a very reasonable step to do, either extending it to maybe 7 days or adding the negative test, or both.